Hey nurses, welcome back to my channel Beginner Nurses. Today we are going to discuss about a condition called shock. Shock is a life-threatening condition that occurs when there is not enough blood circulating around your body. And the lack of blood flow means the cells, the organs, they aren't getting enough oxygen and nutrients to function properly, which means eventually they'll lead to organ failure and death. And let me tell you, shock is a medical emergency and need to be addressed immediately. And for NCLEX point of view, we need to remember that there is an extremely low blood pressure in shock. Well, there are various different stages of shock which we'll be discussing now. Next, coming to stages of shock, and we have 4 different stages of shock. Number 1 is initial stage, and second compensatory stage. Third one is progressive stage, and the last one we have refractory stage. Let's discuss them in more details. So starting with the first stage, which is initial stage, due to decreased blood flow in this stage, the oxygen supply to the cells and tissues is not sufficient, due to which cell hypoxia occurs, leading to anaerobic metabolism. Anaerobic metabolism is the metabolism without oxygen, and which can result into increased lactic acid. But as such, in this stage, there are no signs and symptoms. And now the second stage of shock is compensatory. As the name itself suggests, in this stage, the body tries to compensate for the lack of oxygen by increasing the cardiac output. And in here, the heart starts pumping real quick, resulting in tachycardia, as a result of which the respiration also increase and the patient goes into hyperventilation and we see tachypnea. And in the GU system, we see oliguria. Next, coming to the third stage, which is progressive stage. It means body is unable to save the day in the compensatory stage. So now the condition of the patient or the person is getting worse. And in this stage, the vital organs are compromised. And the key sign to remember in this stage is cold and clammy skin. For NCLEX, it's important to remember it's not the tachycardia or tachypnea in this stage which is a priority, but in this stage it's cold and clammy skin. Tachycardia was in the compensatory stage when body was trying hard to compensate, but now the body failed to compensate and now we are having a progression from that stage. And the last stage of shock is refractory stage. In this stage, all the vital organs have failed, brain is dead, patient will fall unconscious, and unfortunately, this stage is irreversible.